Ever heard about Lymphogranuloma venereum, commonly known as LGV? It's a sexually transmitted disease that you may not be familiar with. LGV is caused by 3 specific strains of a bacterium known as Chlamydia trachomatis. Unlike the more commonly known chlamydia infection, LGV specifically targets the lymphatic system, which is an integral part of our body's immune response. Now you might be wondering how this disease is transmitted. So, how does one get infected with LGV? Let's dive into that next. LGV is a bacterial infection, but how does it spread? That's a great question. Lymphogranuloma venereum, or LGV, is primarily transmitted through unprotected sexual contact. That means whether it's vaginal, anal, or oral sex, if you're not using protection, you're at risk. Now, let's clear a common misconception. You might be thinking, can I get LGV from sharing a drink or a hug? The answer is no. LGV is not spread through casual contact. It cannot be transmitted by touching, kissing, or sharing food or drink, so you can breathe a sigh of relief there. However, it's crucial to remember that LGV is a serious bacterial infection. It's not something to take lightly. Prevention is always better than cure. Using protection during sexual activity is key. Now that we understand how LGV is transmitted, it's important to know the effects it can have on our bodies. What happens to a person who gets infected with LGV? One might notice the onset of symptoms within 3 to 30 days of exposure. It starts with a small, often painless sore or ulcer, usually in the genital area. This might go unnoticed as it heals on its own. However, the bacteria continue to multiply in the body. Soon, the second stage of infection sets in. This is characterized by painful swelling of the lymph nodes in the groin or armpit. It can lead to a condition known as buboes, painful abscesses that may rupture and drain pus. In severe cases, LGV can cause inflammation and damage to the rectum and colon, leading to rectal bleeding, pain, and even rectal strictures, which can cause severe constipation. Early detection and treatment of LGV can help prevent these serious complications. Without proper treatment, LGV can lead to long-term health problems. In conclusion, LGV is a serious condition that needs immediate attention and treatment. Let's recap what we've learned about LGV. This sexually transmitted disease is caused by a specific strain of bacteria. It's passed from person to person through unprotected sexual contact. If left untreated, LGV can lead to serious health complications. It's important to remember the significance of early detection and treatment in preventing these complications. Knowledge is power, and understanding LGV is an important step toward maintaining your health. Remember, early detection and treatment are key to preventing serious health issues related to LGV.